Friends, welcome back to Ophthalmology for undergraduates and postgraduate beginners. Today is the fourth part in this, and today we are going to talk about symptoms or complaints in the history taking. Any person who is going to come to a hospital or approach a doctor is going to have a problem in his body which he experiences, and that one he will express it to the doctor he is going to consult with. A problem suffered by the patient can be a single problem or it may be a multiple problem. Suppose if it is ophthalmology, a patient may say, I am having headache, I am not able to see things at a distance very clearly. Patient may have two problems. Whenever a patient says one problem or two problem, you should ask the patient what is the duration of the problem. Patient will say the problem is present for a particular period of time. If there are two problems, the patient may say one problem is there for a particular period of time, another problem is there for another particular period of time. So both these things we should record it. Apart from that, we should ask the patient which is the exact anatomical location of the problem in the body for one problem or for both the problems, either at the same anatomical location or it may be at a different anatomical location. We have to ask the anatomical location and record it. As far as ophthalmology is concerned, patient is going to have a problem in the eye or eyes. When the patient says he has a problem in one eye, we should put it as right eye or left eye as what the patient says. Next, the most important thing in the symptoms recording is the recording of the symptoms or complaint should be the exact words what the patient says to the doctor or a consultant. The doctor or a consultant cannot have his own version of the symptoms or complaints. He has to exactly translate it to the English word and record it in the case sheet. So that is very, very important. When a patient is having one or multiple problems in his body, the problems has to be recorded in an order. If the problems occurred or started at the same time, then the problem which is more severe should be recorded first. The problem which is less severe should be recorded second. Suppose the patient is having two or more problems. One problem is present for a particular period of time, that is much longer period. Another problem is there for a shorter period. Then we should tell the problem which is having the longest duration and also which occurred first as a priority. Then only the problem which is of a shorter duration and which occurred later should be told. This is called as the chronological order. Chronological order has to be followed in symptom writing. Patient's own word should be recorded in symptoms writing. Anatomical location and duration has to be exactly written in the case presentation. This is all about symptoms. Before we complete this video, we should know what is the difference between symptom and sign. Now, let us see the difference between symptoms and sign. Symptoms is a subjective feeling which is experienced and expressed by the patient to the doctor. It is all about what the patient says to the doctor. Sign is something which is an objective finding which is detected by the doctor demonstrated by the doctor. That is all about the signs. Signs are usually elicited while doing an examination in the patient. Either it can be a local examination or a general examination. That is how it is being elicited. I have put in few examples here to differentiate between symptoms and sign. A patient may have a pain as a symptom. Tenderness is the sign. When you touch the portion where the patient is having pain, the pain will be increased. That is what is called as tenderness. Next is the redness. The patient will say, I have redness in my right eye or left eye. When the doctor examines the patient, he may either find out congestion, that is dilated tortuous vessels, or he may see a fresh bleeding, or it may be a blood clot. That is a sign. Next example is decreased vision. A patient will say, my vision is decreased. My vision is not clear. But when a doctor examines the patient, he records the visual acuity of the patient. As you all know, a normal visual acuity is recorded as 6/6. If the visual acuity is less than 6/6, here I have written it as 6/60. This is less than 6/6, it is 6/60. So this is the sign elicited by the doctor, how much amount of vision that has decreased in this patient. So everybody should be aware what is symptom and what is sign. We should not get confused.